Well, welcome back to TV5 News at 9. Today we are talking about compression fractures with board-certified neurosurgeon Dr. Jay Jaganathan. Thank you so much for being here, Dr. Jay. We appreciate it.
Morning, Colette. Thanks for having me.
Good morning. Well, tell us about vertebral compression fractures first off.
So compression fractures are typically fractures that form as a result of stress on the vertebral body, which is a load-bearing part of the vertebrae. And usually that's a rectangular segment of bone that when you stand up or walk provides support for the vertebral column. In some cases, particularly in older patients with poor bone quality, classically in women after menopause, the bone gets weaker as time goes by with osteoporosis, and sometimes trauma or even fairly minor events can cause the vertebrae to fracture. And as a result of that, the nerve endings and muscles around that area get extremely irritated, and it can be a source of severe pain.
Doctor, how do people know if they have these fractures? What are the symptoms?
So typically, these fractures tend to happen in older patients, but they happen in younger patients too. Classically, the pain is in the back that's localized to a very specific area of the fracture. It's called point tenderness, which just means that you can point to a specific area in the back and you know that that area hurts, unlike muscle spasm where you kind of feel it in a more generalized distribution. Occasionally, it can cause muscle spasms, however. In some cases, pain can be so severe that patients have difficulty with getting up and moving. And in some cases, in rare cases, you can see it associated with cancer as well. So it can be associated with pain that somebody may have in relation to cancer if they have that.
Wow. Now, are these fractures pretty easy to diagnose, doctor?
They are extremely easy to diagnose, and that's the reason why it's one of the reasons to raise awareness of them.
Yes.
Usually they're seen on x-rays, which are the imaging, initial imaging of choice. When the fracture is diagnosed, a lot of times MRI is usually recommended to determine the acuity or the time in which the fracture happened, and the presence of multiple fractures. But sometimes, especially in patients with osteoporosis or in patients with cancer, you have multiple levels of the vertebrae that are involved. In some cases where an MRI can't be performed, a CAT scan might be sufficient, but usually MRI is preferred if possible.
So you have symptoms, then you're diagnosed. Then what's the treatment like, doctor?
So typically the treatment for this is usually what we call conservative, which means that you start with non-invasive treatments such as rest and analgesics, see if that helps the pain. On occasion, things like bracing might be used for pain, especially if patients have a lot of pain when they get up. When these don't work, there are two minimally invasive techniques called a kyphoplasty or vertebroplasty that are excellent outpatient techniques that work very well for pain relief. And what's involved there is that we use a little needle with an incision that's about 1 millimeter or 2, and target the area where the fracture is, and inject a little bit of glue into the fracture. And that studies have shown, especially if you can get to the fractures early, meaning in the first 90 days or so, the pain relief results with these techniques are extremely good. So for patients who are struggling with them where the pain doesn't improve, those are excellent interventional treatments that are minimally invasive with really kind of an outpatient type of recovery that can work very well for pain.
I know patients love to hear about the less invasive treatment. Thank you so much for joining us today with this valuable information, doctor.
Thank you. Thanks for having me.
Of course, you're welcome. You can find more information on today's topic in the hot link section of WNEM.com.